kidneys don't repair and regenerate very well. And that's why it's so critical that you understand a little bit about how the kidneys work in relation to food, so that you can take really good care of them and make them last as long as possible. I really urge you to watch this video all the way through, because the best foods to help detox your kidneys are going to be different depending on what type of kidney problem you have. Chronic kidney disease, also known as CKD, is pretty common. When you reach stage 3, meaning that your eGFR or your filtration rate, we'll talk a lot about this, when that goes below 60 milliliters per minute, now you have stage 3. And if that lasts more than 3 months, now you have chronic kidney disease. And this affects about 1 in 7 in the United States. That's 37 million people. And if you think about your average crowd, then it might be a whole lot more common than you think. The kidneys are full of tiny little vessels called microtubules. And when they get damaged, we have microvessel disease. This is also what's causing blindness in diabetics. So the number one cause of this disease is type 2 diabetes. The high blood sugar causes swelling and damage to these fine blood vessels. The second thing that damages these fine blood vessels is hypertension or high blood pressure. The higher pressure increases the friction and the strain on these blood vessels. Then we can have kidney infections, which is of course an immune issue. This is called glomerulonephritis. And we also do damage with over-the-counter drugs like aspirin and Tylenol, non-steroidal anti-inflammatory drugs. And while there are other causes as well, these first 3 accounts for the vast majority of kidney damage. And what is the cause of these things in turn then? Of course, what we talk about a lot on this channel, it is sugar and insulin resistance. So sugar and insulin resistance is almost synonymous with type 2 diabetes, but they also cause metabolic syndrome. Type 2 diabetes is part of metabolic syndrome, and so is hypertension. A huge percentage of high blood pressure goes away when people reduce their insulin resistance. And also immune issues. Sugar is very detrimental to your immune system. So all in all, sugar and insulin resistance accounts for the vast majority of kidney damage. Now, we really have to understand the stages of kidney disease, because the foods are going to be different for different stages. And it's kind of interesting how they name these, because stage 1 of chronic kidney disease, that sort of sounds like you have early chronic kidney disease, right? But it actually means that your filtration rate is over 90, and that is normal. So in my mind, that would be called healthy, or maybe stage 0, if you will. But for some reason, normal is called stage 1. Then it's equally curious with stage 2, because this is when you've fallen below 90, but you're still above 60. So that would be the pie chart number 2 here. And the curious thing there is that now you are starting to get some kidney damage. Your kidney is not filtering optimally anymore, and you could even have some symptoms at this stage, even though that's not very common. However, when you get your blood results back, and if your eGFR is, for example, 77, like in this case, then you would be right in the middle of stage 2, but you're not going to get a flag because you're over 59. And the lab reference says anything over 59 is normal, even though you're at this point now in stage 2 chronic kidney disease. But stage 3 is when you start to really have some trouble. This is where you really want to pay attention. It's when you're between 30 and 60, and they've divided this into 3A and 3B. Stage 4 is when it's below 30 but above 15. And stage 5 is when you filter less than 15 milliliters per minute. Now your kidneys are really shutting down. So we're going to go through and talk about some different foods relating to this, but understand that when they talk about the typical recommended foods for a kidney diet, they're talking about this segment, this pie right here, between 15 and 60. Stages 3A, 3B, and stage 4. The other stages are completely different. And we'll talk about the worst one first. Stage 5 is when you have kidney failure. Your kidneys are filtering less than 15 milliliters per minute. This affects about 2 million people worldwide. And interestingly, the US has almost half of those. 785,000 people of those are in the US. So even though the US has 4% of the world's population, we have about 39% of all the kidney failures, almost 10 times the average rate. So that should tell you something about this being a dietary problem. The fact that we spend $4 trillion on so-called healthcare has done nothing to reduce these numbers, which again, of course, means that maybe that $4 trillion that they call healthcare isn't healthcare at all, but rather sick care. So again, if you want to get healthy, then you have to learn and understand some things and take care of yourself, not rely on the system to do that for you. And the reason you want to do everything you can to avoid stage 5 is that by the time you get there, there's really only 2 choices. One is dialysis, which is sort of a miracle. It's very nice that they have sophisticated machines to filter your blood for you when your kidneys have given out. That can keep you alive for a while, but it's not a pleasant lifestyle. And the 5-year survival rate is only 35%. That even though there are people who can live 20, 30 years with dialysis, the life expectancy is very, very poor, and a large number of people die within the first year. If you were a normal person and you hit your 60th birthday, you would expect to live to about 80 or 85. But if you are 60 and you get put on dialysis, your life expectancy is about 64 years old. The other option besides dialysis would be a transplant. And the life expectancy here, the 5-year survival, is much better. It's a full 80%. However, there's only about 20% who can get it. There's 100,000 people in line every year for a kidney transplant, but there's only about 20,000 kidneys available. So most of these people have to wait and get dialysis, and a whole lot of them die while they're waiting. So why do people with kidney disease need to limit certain foods? And the problem with the kidney is that it can't filter certain things adequately anymore. And these are sodium, potassium, phosphorus, nitrogen, which is a waste product from protein consumption, and even fluids, even clean water. So while the kidney normally does a fantastic job of balancing and keeping and getting rid of all these substances, when the kidney is damaged, now it can't do that anymore. It's also really important that we understand one of the myths regarding this issue. And what they're saying is, we know the damaged kidney can't filter certain things, that the sodium, potassium, phosphorus, nitrogen from protein, and water, they do damage. They injure further the already damaged kidney. But then they jump to a conclusion and they say, therefore, these are bad things. And by reducing them, the conclusion is that now we can prevent kidney disease. That is not a valid conclusion, because we need protein to build tissue. A healthy kidney needs protein to repair and replenish itself. A mildly damaged kidney needs protein to repair the damage. And these other things are essential minerals. These are very, very important that we get on a regular basis. So a healthy kidney needs these things. A sick kidney, you have to limit them because the body can't regulate it anymore. And to give you an idea how silly this argument is, it's like saying that Weight bearing on a broken bone is bad, because if you break a bone and you put weight on it, if you walk on it every day, not that you could from the pain, but if you did, then that bone couldn't repair properly. And then they say, therefore, weight bearing is bad for bones. While the exact opposite is true, of course, because weight bearing is what builds strong bones to keep them from breaking. Stage 1 and 2, the very early stages, there is no major damage. Your kidneys are still pretty healthy. Stage 1, they're absolutely normal. Stage 2, they're starting to get just a little bit congested. So should we restrict these items? Well, stage 1, I would say no, because you're still healthy. You eat real healthy food, then your body can regulate this. Stage 2, it sort of depends. Now you want to start looking at your blood work. Are your minerals off balance? Are some of these starting to build up? And if they're not, then you're still doing fine. Then you want to eat whole food so that your body has the resources to repair and replenish what it needs. But if your blood pressure is going up and if you have some other problems, then yes, maybe start looking at that. What you do want to do is you want to understand that the problem is insulin resistance. That's what causes it. The sugar and the insulin clogs up the kidneys. So with a low carb, high fat diet or a whole food diet, a paleo type low carb diet, you can stop putting the things in that damage the kidney in the first place. That's the first key. Besides low carb, you want to eat whole food so you get the proper nutrients to rebuild your body, including the kidneys. And what about protein? Well, you do need protein to rebuild the tissue, so don't cut back too far and don't exaggerate by eating huge amounts, because large amounts of protein produces a lot of nitrogen as a waste product, and that can be toxic to a kidney, especially if it's having some trouble. But you'd have to eat quite a lot to really create a toxic load of nitrogen. But if you're getting closer to the 60 here, then maybe restrict the protein a little bit, but remember, you still need it to rebuild your tissues. And then of course, you still want to do some exercise, because exercise creates signals for your brain and your nervous system. It drives every single functional system in your body benefits from exercise. And you want to do some kind of stress reduction, because stress drives blood pressure up. Relaxing and meditation reduces blood pressure. And like we said, high blood pressure is damaging to the kidneys. By reducing stress, you're also going to improve your immune system and reduce the chances of a kidney infection. So stage 5 is a little different than any other case, because now there is major damage. You do not want to try to handle this on your own. You need to be under the care of a medical doctor. This is an emergency. The specialist is called a nephrologist. And you have to limit your sodium, potassium, and phosphorus, because your body can't eliminate it. But you even have to limit your water intake, because the kidneys are filtering so poorly